Good afternoon, everyone. I am Dr. Amit Sharma, medical oncologist from HCG Cuttack. So my job is to tell you in brief something about the role of a medical oncologist in the management of cancer. So basically I would start from the beginning. That is, we have three specialties in oncology. One is medical oncology, second is surgical oncology, and third is radiation oncology. So what's my job as a medical oncologist is to give you chemotherapy, that is the drugs administered through your veins so that they will affect all the cancer cells around the body. So basically when we talk about the initial stages, my job is three ways. One is when we do chemotherapy as a neoadjuvant chemotherapy, so which means before doing any radical surgery or any radical radiation treatment to completely cure the patient, we sometimes want to reduce the disease, and to reduce the disease we use the chemotherapy as initial regimen. We will give you chemotherapy for 3 or 4 cycles. We will assess your tumor response after that, and if we feel that we are safe to go ahead with surgery and radiation, then we definitely will go with surgery and radiation, and later on we will again reassess whether you need any further doses of chemotherapy or not. So this is the first thing when we use chemotherapy as a neoadjuvant, just to reduce the size of the tumor, to reduce the bulk of the tumor, so that patient can go for surgery and radiation. Second thing is when patient is operated already or patient has already received the radiation. In that case, we give the chemotherapy after finishing our surgical or radiation management. Just to make sure that the further tumor recurrence we can decrease as much as possible. So this is mostly the two ways we use chemotherapy in initial stages. The other maybe less times we use is, and we use it as concurrent chemotherapy along with radiation. So that is used to increase the effect of radiation. So this is a three-way: neoadjuvant, adjuvant, and concurrent. Neoadjuvant means before any radical treatment, surgery or radiation. Adjuvant means after doing surgery or radiation, and concurrent means when we used it along with radiation to increase the effects of radiations. So this is the initial stages. When we look at the advanced stages, I personally feel we chemotherapy people are the most important people, because in advanced stages most of the patients will not undergo surgery or any radical treatment as radiation. So the only most possible option left with the patients are chemotherapy. So that chemotherapy, because the chemotherapy is administered through our veins and they can reach every part of our body. So even if the cancer is spread to the lungs or liver or anywhere else other than the primary lesion, still the chemotherapy works. But here the principle is little different. Here the principle of chemotherapy is we assess every 3 or 4 cycles, and if the chemotherapy is working, then we go ahead continue with the chemotherapy regimen, and if it doesn't work, then probably we will go ahead to the another set of chemotherapy regimens. So in a brief, this is the most important indications as a medical oncologist to use my chemotherapy. So that's from my side. Thank you so much for patiently listening. Thank you so much.